Welcome back here to the Mountain Morning Show. As we know, we're well into the month of May, which is Mental Health Awareness Month all across the United States, and we're taking great consideration of that here in Park City. For that, today we have Erin Newman, who is the Health Department Mental Health and Substance Abuse Coordinator, and Dodi Wilson, who is the Valley Behavioral Health and Summit County Director. How are you two doing today?
Great, thank you so much for
Absolutely,
having us.
Absolutely. Dodi, great to see you again. Erin, it's great to meet you. Absolutely. Let's talk about you guys are here to discuss the Mental Health and Substance Abuse Area Plan. Dodi, can you explain to our viewers exactly what that is?
Yeah, so the area plan is comes from the state directives every year, which is based a lot on legislative action and how we basically need to spend our Medicaid dollars for Summit County.
So basically, after the legislative summit, the government comes up with the amount of allocated funds that will be used for, mental health and substance abuse awareness, whatever revolves around that. And now, so this substance abuse and mental awareness plan is to how you guys are going to implement that money in the county or in a statewide basis?
Just us are only responsible for the county.
For the county,
yes,
great.
For Summit County.
That's excellent. So what are some of the things that are going to be implemented with these funds?
So there is a new allocation specifically for opioid money. Okay. And so that money is for us to make sure that we are helping to reduce the opioid epidemic, basically. So really focusing on treating clients that are struggling with opiate addiction.
And Erin, as the substance abuse coordinator, how important, I mean, obviously we know that this is a national crisis right now, but here in Utah we're kind of suffering from it on a little bit higher levels. Why is it so important that we have this money allocated?
Well, I think one of the things that Dodi and her team are doing that's incredible is they're doing more with less. One of the things that Utah was hit with these Medicaid dollars was actually a reduction statewide. Coming in from Washington. So when we look at our about $2 million that we get in state and federal Medicaid dollars, Dodi and her team actually are losing over 122,000 for this coming year, and that has an effect.
Absolutely.
And at the same time, we're seeing a growth in our services and demand in our services. Mental health alone increased 86% in the number of clients seeking help in Summit County between 2016 and 2018. And substance abuse clients increased 67% in that same time frame. So where we're getting hit with this is not only in reduction of services, but in terms of opioids, that's a growing concern and a growing area for us. And the money this year that we're receiving for this allocation is about a little over $33,000 to help both in the outreach and the treatment of individuals suffering from opioid addiction. We had the film last night at the Connect event, Heroin, talking about Huntington, West Virginia, and how they unfortunately are known as the opioid death capital in the U.S. And we're trying not to be that group. We're trying ways to, how do we not only as a county, but as a state, fight this epidemic that's taking place?
We'd rather be recognized as the state with the most resources, right? Rather than the most overdoses or deaths, because that's something that's just way too tragic. And I was able to speak to Lieutenant Governor Spencer Cox about some of these issues, and he said, a great quote, you shouldn't be afraid of having one knee surgery away from being homeless and addicted to opioids, It's really, really scary. Dodi, I'm really curious how you make it work with less funds and able to do more for the community.
Yes, that is a great question, and the only way that we can do that is by working with the community. So myself and multiple other staff, we are very much involved with the alliance that Erin created, which there are multiple subcommittees, and they are really involving a whole different number of, and Erin can speak more about it, of community members. We have to get together as a community and pool our resources together and brainstorm and be creative, because we can't do it alone.
Absolutely, and luckily we live in such a great community that people are so willing to help each other out. Erin, how can we come together as a community, as Dodi is saying, and to make sure that this is an effective plan?
I think you said it just right there. The alliance, it's not, I didn't create it, I just kind of stepped into it. But it's a coalition. It's the community having ownership on this problem. The biggest thing that I think has been a success for us is we're reducing the stigma around mental health.
Yes.
And those numbers that I quoted earlier about the increase in services speak directly to that people aren't afraid to say, you know what, I need help, I recognize this. My son or daughter needs help. My spouse, someone I know needs help, and they're helping guide people, and we're not afraid of it anymore.
I think along with the stigma as well, I think we've also reframed mental health, and at least we're trying to reframe mental health in this country from something that's every so often to something that's more like, like a dental checkup. It's not like you have to consider yourself of really not good mental health or your sound mental health, but it's good to go in and get checked, and just see how things are going and to talk to someone. So I think it's a great thing that we're not only reducing the barrier of the stigma of what it is to receive mental health, but we're also reframing mental health as in general, as something that's not so outskirts in common medicine, something that's more mainstream and something that we focus on and more. You guys also have your 6-month recap of mental health coming up as well. How is that? How are things going?
It's going incredibly well, and again, it's because of our community partners that are engaged in this. I was just looking through our dashboard where we track all the committees and what they're doing. We're at 15% complete with the strategic plan.
Wow.
Now, not all of that is, you see, kind of blaring there. A lot of it's foundational work preparing for other things coming up. But when I step back and look at the work Mary Krista Smith has been doing with CTC, with our youth council, with students comprised of all 3 school districts working on addressing mental health and substance abuse in North Summit and South Summit and Park City. We have a parent training committee that's in the process of finalizing a program for next fall and spring where parents can learn more about how do you handle a mental health issue with your son or your daughter. What do those substance abuse warning signs look like? How can you engage in those actions? We've had great success with Connect Summit County, who's, besides all the work they're doing this month, Shauna Weiss, their executive director, has been spending so much time going to and meeting all of our clinicians all across the county and building a database of who do we have, what services do they provide, because that's a big gap for us. When I came on board, I didn't realize that the state doesn't track who's practicing in Summit County.
Wow.
So she and I started off creating this basic list of, okay, we're looking online, who do we have here? Everything short from the phone book, because let's be honest, no one's in the phone book anymore.
No one's in the phone book anymore.
And we got an initial start, but we knew it was far from complete. And so she's really taken on this task. And their goal with this whole process is to have an online database that anyone can come and search. So we have a lot of these different programs happening. Another one is a tele-assessment system in the jail, to where if someone's in crisis, instead of having to wait several hours or even days, they can simply get on the system and someone down at uni can do an assessment and say, you know what, if this person is able to be transported, bring them on down. We'll get them put in.
Wow.
And we're looking at the exact same system in our schools. We're working with South Summit and Shad Sorensen and Intermountain Healthcare on a very similar program where they can supplement within the school district. So on our schools that are short counselors that don't have the staffing to provide that every day, a student can go into a room, or we still have a lot of details to work on this, but in theory they could go to a room, there's someone that they can talk to right there.
Right then and there at the current moment. Because a lot of the time that we know it, these are timely matters, right? They need to be taken care of in a timely fashion. And a lot of the time the reason we have tragedies is because they're not attended to in a timely manner. People don't take them as seriously as maybe an open wound, you know, or something like that. But in the same way, it can have the same effect on you.
And I think that's changing quite a bit. And in fact, one of the things I'm extremely proud of, and I'm sure we have more, but there's only 4 that we're aware of. QPR, the Question, Persuade, Refer program that we're going to be really pushing out in the next month, that you're going to see a lot of marketing to get people trained in it. We've had 4 different accounts of students who have gone through the QPR training, have utilized that training, and in all probability saved another student's life.
So it's proven to be effective.
It is.
Dodi, I just wanted to ask you, before we wrap up right now, where can people go to keep up to date with everything that's happening and also to get involved as community members?
Yeah, there are a few different websites, and does the Mental Health Alliance?
It's on the Health Department's website.
On the Health Department's website,
Excellent.
valleycares.com, and Connect also has a Connect Is it Connect Park City?
Connect Summit County.
Connect Summit County.
Yes.
Thank you.
Yes, absolutely. Well, thank you both of you for coming on and speaking about this really important topic that we have going on, not only in the month of May, but we want to make sure that this is a year-long thing that we're very, very cautious and concerned about. So thank you so much. Really appreciate it.
Thank you.
Absolutely. You heard all of the resources to go to. There's so many, but definitely check out Connect Summit County as well as the Summit County Health Department's page for more information on how you can get involved as a community member here in Park City to assist everyone suffering from any mental health issues. We'll be right back right here on the Mountain Morning Show. Don't go anywhere.